Elijah. Welcome to In Focus. We have here today as our guest, Frank Lescas. Thanks so much for joining us.
Yeah, my pleasure, Michael. I work for Blue Earth Diagnostics. We are the developer of innovative radiopharmaceuticals, which are used in the detection of cancers. We currently have 2 products specifically in the prostate cancer space, but we have others in the pipeline that are looking at other cancers. And we feel that this use of radiopharmaceuticals allows physicians to get a better picture of their patients so that they can create better treatment pathways that are individualized, that are precision medicine for each patient that comes into their practice.
I know, Frank, you have a wide variety of different companies and experiences that you've worked at. We've worked with you on a few different projects, both when you were on the agency side and now in-house at Blue Earth. So I'd love to just hear a little bit about really, before we really dive into it, how you got started in the industry, how you got started in marketing and specifically healthcare marketing, because that's such a specific niche.
Yeah, it's a great question, and it has been an interesting ride, if you will, since I graduated college way back in the Wayback Machine. But it was local kid from Philly, went to LaSalle University. I actually graduated with an accounting degree because my dad growing up said, son, you need to get into business. And so the accounting seemed to come easy to me, so I got into the accounting field. But when I graduated and started working at one of the big accounting firms, I realized very quickly that accounting really wasn't my forte. The intensity in that field is real, and I am more of a fun, jovial type of a person, and found myself quickly getting out of that and into trying to get into the sales side of business at that point. And the only sales I got into was recruiting, which was interesting, and learned a lot about people and careers. And I came across a job that I had to fill for a friend, and it was for a pharmaceutical sales job. And I was interested. I had never really understood the pharmaceutical side of the business. I had no real entree into that business. And so it was interesting to me, but it was very much a foreign concept. And then it wasn't until several years later, and it's just so luck and happenstance that sometimes life presents you and you take advantage of it. But I had been asked to go to my parents' house. My mom and dad had gone on a trip with 4 other couples, and they wanted us to come back and plug the camera into the television so they could watch the video that they shot. Remember, this is in the 90s, right? Before we had iPhones. This is old school cameras, VCRs, their VCRs still blink 12 every day. So I had to plug into the back, and they said, come over. If you could do this, that'd be great. We'll have cocktails and food. How could you pass up cocktails and food as a mid-20s young man thinking, this is a nice meal for me? And I knew most of the couples. I didn't know everybody, but I knew most of the couples. And I ended up meeting with one of the spouses that was there, and we were chatting. And she said, I asked her what she does, and she says, well, she was a district manager for Bristol Myers Squibb. Oh, that's very interesting. Tell me a little bit about what that entails. And after a while, and I have my recruiting hat on the whole time, thinking, is there a job opening here that I could fill, right, to make a commission from the recruiting side? And she said, I actually do have a job opening. It's in the North Philadelphia area, so I need somebody who can carry themselves okay and who can speak Spanish. I was like, oh, okay, well, that's interesting. And tell me a little bit more about the job and the perks and such. And so that night I got to thinking, and I said, well, I can't speak Spanish, but I know North Philly pretty well, and I think I can carry myself. So the next day, I sent my resume to this person, and I said, I'm interested in the job. And she was taken aback. She wasn't aware that I had any interest, but I said, no, I do. And then it went through a 9-interview process with a bunch of people to try to get into the pharmaceutical sales side. And that time, in 1998, 99 timeframe, it was 98 actually, the pharmaceutical industry had swelled. You think of the innovation that was happening at that time with products that had just been launched in the mid-90s. And so the idea that more and more sales folks in pharmaceuticals was a thing. And so I remember perfectly the last interview I had was with the regional director of Bristol Myers, and he says to me, Frank, what makes you think someone with no medical background that you can stand toe-to-toe with our customers and articulate the features and benefits of our products in an intelligent way? And I looked at him and I said, Keith, if I can understand the Internal Revenue Code, this thing's a piece of cake. So he laughed and he said, okay, you got the job. And so, I started in 1999, and that was really the beginning of the journey. But from there is really where things get interesting following that. So, spending 5 years of Bristol Myers Squibb selling products, that's where I really cut my teeth and learned more about storytelling. I never really understood what really made up sales until you understand what the customer needs are and how do you articulate those needs in a way that resonates with the exact customer that you're speaking with. And I always revert this back to like selling a car, right? You get the brochure that has all the dimensions, all the specifics about the car, but if I'm 25-year-old man and I'm going in to buy a car, that's a different conversation than if I'm like 45-year-old female with 2 kids strapped to me buying a car, or maybe different areas of the country might have different things, aspects of the car that would resonate more with that customer. And so you have to tell that story. And I learned that early in the sales side because I kept saying, geez, each patient is different. Their life experience is different. Their challenges are different. In some cases, a side effect of weight gain might have a huge impact on particular customers. It may not have on others. So when I'm painting that picture of a benefit of our product, of less weight gain using this product is, one of the ideas, I'm thinking of a patient. Now, how do I tell that story about that patient? Well, then it got me thinking, like, it's okay delivering the message. I like to create the message. And so when I got out of the pharmaceutical sales side of things and got into the service side, into the agency side of business, I spent a lot of time working with key opinion leaders and thought leaders trying to understand what are some of the challenges they have? What are some of the issues that they face every day? When they see a patient, what are they thinking? How do they approach the treatment of that patient? What information do they need to know to better tailor treatments to those patients? And that got me into more thinking of how do I deliver that then? How do I deliver that message to a customer? And that's really where you think of benefit ladder, meaning getting out of just the features and benefits of your product. But what does that enable you to do as a customer or the patient? And then how does that make you feel? Because really you buy the emotion of the product. You buy through emotions, not necessarily through the functional benefits. And so we're able to kind of get to that point where I now feel like I understand more what the patients and the clinicians are going through. So now I've translated those skills into becoming now, which was one of my clients, was Blue Earth Diagnostics, is now who I work for. And I became the VP of marketing of Blue Earth Diagnostics back in September of 2020. And since then have had a really fun ride of not only an existing brand, but bringing a new product to market, which has its whole sets of interesting challenges when you're doing that in a competitive market.
Wow, that was a lot. And thank you for that background. That's so interesting. And squeezed in there somewhere, you did an Olympic swimming run too, right?
Yeah, that's true. So that was when I was in college, which was an amazing experience. And Mike, we could sit on the phone here for about another 2 hours talking about that experience. But then the net of it is in 1992, I had the esteemed privilege to represent Albania, which is my home country, and represent them in the Olympics in swimming. And it was just an incredible experience to be able to travel. We had never been to Albania. But Albania was part of the Iron Curtain back between World War II and up until 1991. So the country was finally open and got to see where my family was from and see the small villages that they escaped from to come to America for a new opportunity. And so to be able to go back there and then represent them in Barcelona, to walk in the opening ceremonies, which is an incredible event, and then, of course, compete with some of the heroes that I had growing up in swimming were all surrounding me, competing for either America or for other countries. And to see them there was just an incredible experience. And of course, that will live with me forever, those experiences.
I had a follow-up question, Frank, just hearing about your progression starting and where you are today, specifically about one thing you mentioned regarding understanding the patient experience as a imperative to being an effective marketer and effective salesperson. We've done a lot of work in pharmaceuticals and healthcare in terms of video production and marketing as well. And one of the themes that comes up a lot is remembering that the patient is not a number, like they're not just a number on a spreadsheet. And it's so easy to forget that, especially when you're trying to communicate to large people groups or demographics or parts of the country. Does that play into your day-to-day? Like, how do you face that challenge?
That's a huge challenge, and thanks for bringing it up, because if anybody has had kids, they know when you're coaching your spouse as they're delivering their baby, you see the monitor adjust before the mother feels the pain, that you know the contraction is coming. And so you have a tendency to say, okay, here it comes, here it comes. And then they get all nervous, and all of a sudden it comes and they're like, oh, it hurts so bad. But the idea is don't coach the monitor, coach the patient. And I think we get into a point, clinicians do, and a lot of times it's because they're overworked and they're burdened with a lot of paperwork, and they're treating the numbers. They're treating the high blood pressure, the numbers of high blood pressure, and not necessarily the patient undergoing whatever they're happening in their life. So while you have high blood pressure, we're going to give you a pill. They could have asked, what's going on in your life? What's changed? What are the issues that are happening? Oh, you broke your arm. I'm going to put a cast on it. Great. You've solved that. But why did they break their arm? Well, I fell down the steps. Well, why did you fall down the steps? Well, I got dizzy. Aha. Why did you get dizzy? And you really start to peel back the onion of what's going on with that patient. Our healthcare system today doesn't always give us the time to do that. Now, in oncology, it's a little different. And I spent the last 23 years now in oncology. And so when you think of cancer, most of those physicians spend more time with their patients. The unfortunate thing is it's so overwhelming for the patient that a lot of times they don't hear. And so they may be asking questions and the patient heard the C word and the conversation is over, which is why it's so important to have an advocate with you, whether a spouse or family member who can listen, who can take notes, who can ask the questions, because it is overwhelming at that point. But it is important. And when I think about my product in the sense of what difference we can make in the patient's journey, of course, we're a diagnostic agent, so we're not treating patients, which is a whole nother world. But without the right diagnostics, you don't get a full picture of what's happening with your patient, because that picture tells a different story. It's not just the person sitting in front of you. It's not just the numbers. It's the full picture. And then you can make a shared decision with patient and physician together. What's their best approach for that patient? That's so important in what we do now, especially in this era of precision medicine. We can really think more thoughtfully about what makes more sense for you versus somebody else. And everybody's situation is different, which is why you got to understand the patient journey and what's happening in their life.
I know we did that campaign with you, specifically surrounding more or less the patient journey and some of the work you're doing at Blue Earth Diagnostics. Could you talk a little bit about the campaign we did together, and then how you ended up using those? I know we did a lot of photos and video assets. How did you end up using those assets also?
Yeah, and that campaign was great. Appreciate your help in that, because one of the things when in a diagnostic world, you might think, well, I have to get an MRI or a CT scan. And most people are familiar with an MRI or CT because they've broken an arm, they've been in for other testing. When you hear I'm going to get a PET scan, and it's a nuclear PET scan, next thing you know, people are starting to think, well, nuclear, what do you mean by that? And what do I have to do? And what is this scan all about? And they start getting concerned. The whole idea of the campaign was to make it sound less scary, make it seem like this is routine, which it is, by the way. Take some of the stigma out of, I'm getting injected with a nuclear pharmaceutical, a radiopharmaceutical. What does that mean? What is that going to entail? What impact is that going to have on my life? And so to dispel some of the concerns that the patient would have, and then also show some of the challenges and how these products are made, because it can be disruptive in scheduling and ensuring that you get to your appointment on time, because the way it's injected, you really have a small window of opportunity for each patient in order to get the best results in the scan. And so that campaign allowed us to humanize this whole process and to make it less scary. We've used it on our company website. We also have used snippets in social media, which have been great. And now we're looking at doing a paid social media campaign using the assets or snippets thereof to drive more traffic, to get people to understand that this test is not as scary as it may seem.
How important is, not just in this campaign, but throughout your career, is video collateral to helping tell those types of stories? Like in this case, it sounds like maybe demystifying the process a little bit. In other cases, I'm sure there have been different objectives, but what can video do that other mediums can't?
I think of a PET scan as video and a CT or MRI as a flat image. So it can show you an anatomical difference, but it doesn't tell you what's happening there. And the PET scan does that. I feel it's the same in when you think of any communication. The words on the page are words on a page. But when you actually hear those words come to life and you see them in action is when you can really understand the impact of them. So I feel like video has a huge impact on being able to communicate a story. Sometimes even without words, you can feel emotion through music and through acting beyond just, the words themselves. I think they all tell a great story. And, I watch as an advertising guy, it's funny when the commercials come on, everybody goes away and I'm like focused in on the commercials, and there's more and more pharmaceutical commercials these days. And I'm really focused on that time frame when you hear the side effects and the safety. To see the visuals that are playing in the background, there's usually, most people are at this point visually turned off. I'm visually tuned in because I want to see what they do. And at that time frame is actually telling the story of the brand through imaging and through video with the sound talking about the side effect. But you really see the benefit of the brand in that phase. I was watching a commercial yesterday and I was even thinking about, wow, that patient they're not tethered to their home because of the condition they have, is what I was thinking as they were doing all these activities. And that really told a bigger story than what the benefit of the product. If someone said to me, oh, it does this or the other thing, what I saw was that they were free, that they could do what they needed to do. And that told me a bigger story that you could imprint.
So interesting to think about. Yeah, same
You're
thing.
going to look at commercials in a different way from now on, seriously.
Yeah. I always watch the commercials too. That's like my favorite part. I'm not a big sports person. I wasn't in the Olympics like you, so I can't say I'm a big sports person. But during like a football game or something like that, if I'm watching with friends, I might be on my phone during the game and then the commercials come on. Everyone else tunes out. I tune in and I watch all the commercials.
Well,
So-
what's interesting too, Mike, you bring it up, years ago when watching a sporting event, just think of what the commercial mix was, let's say 10 years ago. It was beer, right? You had all those Bud commercials and then it was cars, all the Chevy and Ford commercials back in the day. That was really the mix, maybe a few other things, thrown in there. Today, you're getting inundated with, in any commercial break, a minimum of 1, sometimes 3 different drug commercials and or healthcare, right? Because sometimes I see ads for the local hospitals, whether that's Jefferson or Penn or Atlanticare. But you always get anywhere from 1 to 3 commercials on healthcare. Because I think when you're thinking of storytelling, that's really where it's most important. People need to understand their condition, and that's a great vehicle to be able to articulate that. Yeah.
That's so true. And without spreading the message, people are never going to hear about the treatments anyway.
Yeah, that's another thing too. I mean, there are now so many treatments for a singular disease where years ago we may have had one option. Now there's multiples. So those multiples, although nuanced potentially in their efficacy benefit, may not be significant. The side effect differences may be different, may not be significant, but there's some nuances maybe with dosing or different monitoring that may make it more beneficial for the patient. Again, going back to the patient, what's most beneficial for them? And it's hard because clinicians are inundated with a lot, their patients are coming in all day. They're inundated with a lot of information. They have to decipher all this. And the patients are coming in trying to decipher it. And so to try to create a succinct language that we can all talk about that tells the right story, I think is important.
What do you think of when you ponder the future of marketing in your industry? There's obviously healthcare is a dominant force in our country in terms of the advertising world. And what's on the horizon?
I think if we look back, and pharmaceuticals are always 3 or 4 steps behind consumer advertising. And it's a function of the regulatory environment that we work in. It's highly regulated. People take these baby steps into the future. But if we just look back 25 years, I first got in the industry, most drugs did not have a website, but they had Salesforce. They had people out there talking to customers. And then slowly we got into digital ways of marketing, and now more video and television ways to get to patients and to get to physicians. Really, because our physicians are consumers, right? Once we start to understand that the physician is just as much a consumer as anybody else, we're seeing different ways to get to that customer. It used to be 7 interactions was you can make a lasting impression after 7 interactions. Now that number's 63, right? It's growing because everybody's getting bombarded with messaging. How do we get the right message to the right time to the right customer? That's marketing 101. It'll still be our challenge. So we have to meet our customers where they are. That's the first thing. So where are they? Well, they're on TikTok, they're on Instagram, they're on Snapchat. As much as our young children are or other people we know, they're there too. They're just as much enjoying those platforms as we are. And so no reason why we can't start to think about how do we serve content in those markets. The second thing is when you get them, you can't serve the generic content anymore. When you go to a consumer website, think of ESPN as the best one because I've already kind of tagged in there that I'm from Philadelphia, so I'm a Phillies fan, I'm an Eagles fan. So when I go there, all the content that's related to those sports teams always comes up first. They don't serve me a generic ESPN. They serve me the ESPN that I want to see. And I think we need to think of that on the pharmaceutical side as well. So if we understand a few pieces of information about our customer, we need to then share the information that's most relevant to them so that they don't have to hunt and fish for it. If they have to click more than 1 or 2 times, we've lost them as a customer. If we're sharing, whether it's video content or not, if any content we share that's not relevant to our customer, they will bounce out very quickly. And so how do we create a more nimble environment in a highly regulated field to be able to share information that's relevant to our customer, for our customers? And then how do we do that cross-platform? So if they've entered through Twitter, and we know a little bit about their background there, how do we translate that into the content we serve them on our website? Or if they enter through a different channel, how do we serve them that information appropriately? That's really, I think, the future where we'll get to. The consumer brands already do that. So I know where we're going. We just have to get there. The other thing we have to think about is how do we pair things together? When you think of this, you need to have this, right? When you think of a hamburger, you need a Coke, right? When you think of a football game, you think of a beer. How do we do that in healthcare? How do we think of when you have one thing, the product association comes with it? That's another level of where we'll get to eventually in pharmaceutical marketing.
When you think of a nuclear PET scan, you think of Blue
You
Earth.
think of Blue Earth Diagnostics or you think of our products. Exactly.
When you think of 7 Wonders, you think video, or the other way around. Whoops, I botched
When I
it.
think
When you
video,
of
right?
video,
When I'm thinking quality video content, I'm thinking 7 Wonders Cinema.
there you
There
go.
we go.
We'll clip that out and then blast that everywhere.
I'll tell you what, though, just as an aside, and then I work with a lot of video production groups. And what I really liked about your team in particular is you understood what we were trying to do. I didn't have to micromanage the process. You guys, the producer on the video we did for the PET scan was unbelievably buttoned up, had everything squared away, understood what I was trying to do, and created the shots necessary to create that emotive response that I was looking for, and knew how to work with the talent in such a way, and understood how to work with me to get my feedback when necessary, but I felt like I had to be in it all the time. So you guys did a great job with that video, but some of the other stuff we did too, you understood my creative ideas, which is not easy to do, but you understood my creative ideas and you took it in the direction that was exactly the way I wanted to go. Like you almost read my mind. And I think that just comes from experience being in the field and understanding the storytelling side of things. What are my goals of this program? And you knew how to get me there. And like I said, I've worked with other video guys and it was much more challenging.
Thank you. Thanks for saying that.
Yeah, that's
completely
very kind, Frank. Thank you.
unsolicited too.
Unsolicited. No, seriously, just unsolicited.
I have another question just out of curiosity, especially in your field. One of the things that we're getting asked to do a lot, Frank, and one of the main reasons we're actually doing this show is thought leadership content, like positioning the experts within brand leadership, getting them to speak more consistently on LinkedIn and on social channels and on website, even if it's in somewhat of a lo-fi type of environment like this. Do you see that as a trend, like in your world? Maybe not in your business particularly, but just in the broader landscape?
The short answer is yes, but now I'll give you the long answer. Because I think the long answer is important because it comes down to source credibility. If I'm buying a car from Ford and I open up the brochure and it says, Ford's the best car ever, we have the best braking system ever, I'm like, wow, this sounds really good. And immediately I have some level of skepticism because Ford made the brochure. But when J.D. Power and Associates comes out and says, we've ranked Ford the best braking system in the industry, there's a level of credibility assigned to that source of J.D. Power And now I feel better as a consumer to say, that's a product now that I can buy. Right? It's meeting my expectations. In the medical world, it works the same way. And if you think of the adoption curve, the first 2 to 12% or 2 to 15% of customers that are early adopters or innovators get into the product early. But it's that late majority or early majority and late majority that are waiting. They're waiting for some source credible person to come out and endorse it in a way. Now, not necessarily endorse it like the Good Housekeeping seal, but some level of, wow, Dr. Klein said that he uses this material, or Dr. Hope said that she likes this kind of treat. Next thing you know, it's like, oh, well, if Dr. Hope says it's okay, Dr. Klein says it's okay, then maybe I'll give it a shot. And you've broken that first barrier of skepticism to trial. Right? Now it's important that once they decide that they're going to try the product, that the experience beyond that is at, the pinnacle, so that they stay with the product. And so it's that first breaking the seal, and you need thought leadership to do that. You can see that in journals, whether you get a journal, but unfortunately today we've moved away from print journals. And I think there's a lot of, as much as I like the ESPN content, it serves me just what I want, but I don't see the news from let's say the Yankees to see what deals they're making. Maybe I don't care. Maybe I do care. But it's the same thing in medical journals. If I'm interested in one particular topic, they serve me that topic, but I may miss this. And I think the video content provides a vehicle, again, to hear directly from the horse's mouth that this is the product that they, or the approach that they take, inclusive of the product, so that they can see that this is a valuable thing that they should do. It's invaluable for us as marketers to use that because, again, you can get 15% of the market. It's how do you get the next 65%? And it's using thought leadership or leveraging thought leadership, leveraging the video assets to be able to do that.
Yeah. And social proof's just such a big thing in general. Just like, absolutely.
Well, and formats like this are great because you're a brand that is conveying that you are a thought leader in your respective space. And then you invite guests or colleagues or other thought leaders within a related space or also in your space. That instantly boosts your credibility too, because it's showing your audience that, look, like we have the endorsement essentially of these colleagues or these other experts having a conversation around this topic. That inherently provides trust.
1,000%. Now here's the challenge. Who's the right person? Right? Who's the right thought? You're too young, but when E.F. Hutton talks, people listen. That was a commercial way back in the 70s and 80s. It was an investment broker. And it was one of these commercials where they were like sitting around at dinner and everything's very crowded. And then E.F. Hutton, the guy, was saying, like, I really think we should. And everybody's like, what's he going to say next? Because it's so
funny.
important, right?
That's funny.
Who are the E.F. Huttons of your disease state? Who are the ones that when they get to the podium at a conference or they get onto a video, that when they say something, people are going to respond in the affirmative? That's the hardest thing, because you can put your eggs in one basket and that basket may not be influential. And it's hard to tell who has the most influence. Just, hey, this guy writes a lot of papers, this one's on the podium a lot, but who's the one that's actually influencing? And that's a very unique thing within pharmaceuticals. There's a lot of research that goes into that, but choosing the right person can be incredibly important for you.
Yeah, absolutely. Well, I think for our generation too, it was the Dos Equis most interesting man in the world.
The most
Yes.
interesting man in the world.
He retired recently too, though.
He did. He did retire. You think of Matthew McConaughey in the Lincoln commercials, and I go back to cars because consumers are very easy, but you see that guy driving around the car and he's a cool dude driving the car, kind of experiencing life in the car, right? When those commercials are going on, they never really talk about anything about the car handling or any aspect of the car functional benefits. It's all about him being him in the car. I want to be like that guy.
It's the experience.
all right.
Yeah.
Right, all right. That's
Yeah.
right. And that's the perfect person for that car. And there could be a lot of other people who drove that car and be like, but that guy really is the epitome of that, who they want to be as a car manufacturer. Lincoln, right? Who Lincoln wanted to be was really that feeling you get with Matthew McConaughey.
Yeah, and Mercedes is John Hamm.
Which is such a perfect choice because he's Don Draper. He's Mad Men. And I was going to reference Mad Men too because I feel like that's what that show's all about, like selling the audience the experience as opposed to the product itself.
They talk about it specifically in the Jaguar era. I forget which season that is, but as an advertising guy, that was nightly homework was to watch that show. There's others too I can point you to, but that was a great one. But when you think of the Jaguar experience, and I remember clearly the dealer came into the offices, and I got to move metal. You got to put the price of the car on these ads. And he said, that's not what we're in the business for. You're the sales guy. You're moving the metal. We're trying to get them to understand the idea of why they want the car, why they should want a Jaguar. That's what we're selling. You're selling the car. And that's really the difference between marketing and sales, right? So in marketing, I'm not necessarily selling the product, but the idea of why they want the product, really establishing that unmet need and trying to solve it, that with our product so that there's a desire to have the product. And then they actually have to move the metal at some point, get the product into the patient's hands. That's a different story, right? That's the sales side.
That's so true. And I feel like that's a nuance that sometimes it's hard for marketers to grasp that idea sometimes too, is the difference.
Yeah, and a lot of times marketers come out of sales, right? It's in one of those progressions in the pharmaceutical world especially. You get so far in the sales, like in your sales career, and you're ready for the next step. And a lot of times you go into sales training or you do a rotation in marketing. And then they go into marketing like, wow, this is great. I love marketing. Of course you do. It's a lot of fun. When they get in, they think of their job from the sales perspective. And what you have to think about your job is really from the customer's perspective, right? How do I solve a customer challenge? And the customer challenge is laddered up above the function of the product. And again, think of the car. I'm trying to sell, like we thought of Volvo. Right? Volvo is known for being the safest car on the road. Does that mean that Ford doesn't have good airbags, that they don't have a good braking system? No, they do. They just aren't positioned as that. Can you put a car seat in a Jeep? Absolutely you can, but they're not really known for the family car, or at least the Wrangler isn't really a family car. Can a guy in a suit and tie get into a Ford F-150 and drive to work? Yes. Are they selling to that demographic? No. They're selling to cowboys and workmen and a different kind of audience. That's their position. They've chosen a target market. Doesn't mean that they can't sell to anybody else, but their target market they're trying to reach are people that are work with their hands, or a mother of three, looking for a minivan, or a guy looking to drive to the beach on the weekends with a surfboard on the back for my Jeep Wrangler. Doesn't mean that I can't own it. I'm not a surfer. Doesn't mean I can't own it. It's just that's not who their target market is. And that's a lot of the branding and the positioning that comes into the marketing side that a lot of sales folks don't quite understand. It's because they just want to sell product. Go sell it to anybody. Great. But who our product is most useful for, who we're trying to really sell to, is a subset of that overall market.
I have a question for you. You're doing a lot of car analogies. Maybe this is something new about you that I didn't know before. Are you a big motorhead?
No, not at all. You open up the hood, I couldn't tell you one thing about a car. Nothing. I have no idea. I drive a Toyota Tacoma, and the only reason I got it is 4x4. And in where I live, I can take my truck on the beach, and it has to be a 4x4, which is why I got it. And it's great. It's a pickup. I can drop the tailgate, drop my chairs right there on the water line. Never have to worry about schlepping anything, because that's a pain. I could take a grill. It's perfectly set up for me. So that's really
So I wonder, was the marketing of that vehicle positioned around take this vehicle on the beach?
Definitely it's a very versatile truck. And I think that was what appealed to me was the size, because it's small. I'm not a big truck guy, although after being in it for the last 5 years, my wife's telling me, I think we should get a bigger truck. But right now, I'm very happy with my Tacoma. It runs great. It's great for the beach. It's great handling in the sand. That's the only reason why I have it. Or else I'd have like a little car with a stick shifts, little sporty kind of a thing. It was probably what I would go with, like a Mazda Miata. Something I could throw the top down and kind of drive around. Although I'm a big guy, they're really small cars.
Yeah, you're what, like 6'3"?
6'3". Yeah.
Yeah.
Yeah. So.
Frank, just one more question for you. To anyone looking to get into pharmaceutical marketing, do you have any advice for them?
It's not easy to break in, but it's worth every effort you have to get in, because it's a great industry. A lot of people get into the service side, into the agency side. So there's several different agencies you could consider. That would be a good breeding ground for information. So whether that's advertising or medical communications, or you can get into other service site type groups and there's many of them. I would name them, but I'm not necessarily endorsing anybody at this point. But there's several other groups that service pharmaceutical marketing. You could try to get into a pharmaceutical company, maybe at the ground level, and like an associate brand manager, or somebody who maybe do meetings and events coordination for a pharmaceutical company. You could try to get into sales. There are other companies that also serve where you can, air quoting, rent to rep companies where you can work for them and they outsource your services to pharmaceuticals. It's a great way to get in from the ground level without any skill or without having an in to get into. It was very difficult. But once you start, you just think of where this healthcare industry is going, and it is innovative every week. I can look up every day on my computer at 2:00. I get an email that tells me 15 new innovations in oncology every day. Things are happening. You don't find that in a lot of other industries. So there's new diseases we identify every day. There's new treatment pathways. And so it's an innovative type of an environment that gives me constant challenge to stay ahead of the data, to stay ahead of the market. What's happening next? How do we prepare for that? The competitive market is growing. It's not like, again, thinking of the car companies, there's 10 car companies. We're not seeing a new car company every year come out. Tesla was probably the biggest disruptor in car manufacturing. We see that on an annual basis in pharmaceuticals. Every year there's another disruptor, whether that's a device, whether it's a drug, whether it's treatment pathway. Those things can upset and change the whole landscape very quickly. Try to stay on top of that just from a mental side, from a mentally challenged. It's wonderful. I feel like every day is a brand new day and there's 100 challenges out there that I need to better understand so we can stay 2, 3, 4 steps ahead of it. I think it's a great industry. I would implore those who are interested in getting into it to do what they can to get into it because it's really a great industry. I've had the pleasure since the late 90s, 98, 99 is when I started my career. So 25, 26 years later, and love every minute of it.
Awesome. Perfect. Thank you.
Yeah.
Thank you, Frank.
Thank you.
Thank you, Frank, so much for joining us today. It was really interesting discussion about your industry and your experience. So thanks so much for joining us.